big thing that everybody's talking about now, as you know, is Medicaid and Medicare. What is actually going on with this? And as it affects Obamacare and the enrollment periods, many states like Virginia have expanded Medicaid to give more opportunity to the working poor. Joining us now, the person who is actually in charge of managing this whole thing from the U.S. government, Seema Verma. Hey, Seema, great to have you with us.
Thanks for having me this morning.
Seema, tell our audience, share our audience across the country, what you actually do and how it affects people's everyday life.
So I run the Centers for Medicare and Medicaid Services, and so that's the Medicare program, that's Medicaid, and also the exchanges. So that's about 130 million people. We are the nation's largest insurer with a budget of over $1 trillion, so around a third of the federal budget.
That's a third of the federal budget. You can't even get your arms around that because the federal budget is what, Seema, now? It's $1 trillion, isn't it, annually?
Yeah, it's over $1 trillion.
So if you represent
one of the things we get concerned about is, we are headed towards spending $1 in every $5 on health care. So one of the things that we're working on is trying to figure out, how can we lower the cost of health care. I think many people are feeling this when they're paying higher premiums, when they're going to the pharmacy counter and having to pay more. Right now, we are in the middle of open enrollment. So this is an opportunity for people that may not have health insurance or need help paying for health insurance to come to healthcare.gov, and they can shop around for the plans that are available. And if they need help, there's also an opportunity to get screened to see if you qualify for some of the tax credits that are available.
Let me just ask you this. I think this is a very valuable question here. For Obamacare and the exchanges, right? Everybody kind of went through that when it first was launched, and their coverage, like mine, just got canceled. Like they didn't offer it anymore, and you had to go on the exchanges. But that's, this is now 6-7 years removed from that. What is the activity with the exchanges, and how has the Trump administration been able to manage that better, or are there any actual changes?
Well, the Trump administration, I think all of us have been focused on making sure Americans have access to high-quality health care and make sure that coverage is affordable. After many years of double-digit rate increases, and since Obamacare started, rates went up by over 100%. That was the case when the administration came in. What we've tried to do is to stabilize the markets, and I think for the very first time, you are seeing rates actually went down this year across the board by about 2%. In some cases, in some areas of the country, that rate was even higher. In Tennessee, it was 26%, Pennsylvania, 15%. So we've tried to stabilize the market. That being said, we understand that coverage is still expensive for many Americans. And after seeing these double-digit rate increases, at least we have some stability, but the rates are expensive. The other thing the administration has done is to provide some other alternatives. With Obamacare and the coverage it gives through the exchanges, that can be very expensive for many families, and we still have 20 million Americans that are uninsured. And so there are some other opportunities that we've tried to open up, short-term limited duration plans, which don't have to follow all of the Obamacare rules. There's association plans. And so there's, we're trying to create some other avenues and some other options for families that are struggling to pay for health insurance.
You're on the John Fredericks Radio Network, Trucking the Truth Across America. We're with Seema Verma. She is the administrator of the Centers for Medicare and Medicaid Services, CMS. Now get this. Seema manages a budget that is about $350 billion with a B, annual budget, $350 billion, which represents 1/3 of the entire United States federal budget of just over $8 trillion. This is unbelievable to have her on and how she's navigating her way through all this. Now, if you need to change your current health plan or find a new one, now's the time. You got to go to healthcare.gov, healthcare.gov. Now, what if somebody has a plan now, but they just want to see maybe they get a better one? Can they do that?
Absolutely. And that's the important opportunity that you have with open enrollment, which ends on December 15th. It's an opportunity to shop around. You can compare networks. You can see what doctors are available. You can see what premiums. If the premium could change, maybe you can find a better deal. And as I said, this year we have more choices, and we're seeing our lower premiums. So there is an opportunity, even if you like your coverage and you're happy with it, you still may want to check around and see if you can get a better deal. We always encourage people to do that. We have increased competition. There are new plans that are available this year. And so I think, anytime you have increased competition, there's a better opportunity for quality and lower cost.
Now, Seema, many people have argued that if you were able to buy health insurance across state lines, that somehow the cost would come down. How does that argument play into the exchanges?
Well, I think that's something that we're going to look at. In fact, you'll see the administration take some action on that. We want to create options for Americans to have more affordable coverage. And I think anybody who's paying insurance premiums, whether it's through the exchange or other places, we've all seen our premiums go up. And so what the administration wants to do is create opportunities for lower coverage, and selling across state lines may be an opportunity to provide lower price coverage because you're able to put more people together and lower prices for everyone. So you're going to see us take action on trying to see what we can do around selling across state lines.
Now, Seema, just two things I want to remind our listeners. December 15th is the deadline at midnight, whatever time zone you're in. Today's December 13th. You got 2 days, and then open enrollment closes, and you're done. So check it out. Just go to healthcare.gov and check it out. Go to one of the plans. You might find a better deal, you might not, but if you don't check it, you don't know, right? What you don't know, you don't know. Now, Seema, let me ask you something else. So according to the information that your office put out, you're saying that, for instance, if you take the silver plan, that you've actually seen a decrease by about 1.5% in cost over 39 states. The Democrats, though, were saying, look, since Trump took over and screwed with Obamacare and took out the mandate and took out the fines, that premiums are going up by 20-25%. People are getting hammered. Which story is true?
The reality is premiums were up, and they've gone up by 100% when the Trump administration came into office. When we came into office, what we were seeing was that health insurers were fleeing the exchanges. And you had about 50% of counties with only one choice of insurer. And the hard, cold facts is that this Trump administration has stabilized the market. And for the first time, the very first time since Obamacare started, we're actually seeing the premiums go down. And we have made a number of policy changes to try to make sure that people have access to affordable coverage. There's a number of things that we did in terms of short-term limited durations. We gave some waivers to states so that they could get out from underneath some of Obamacare's onerous requirements, and giving those waivers actually resulted in lower rates. And we changed some policies to stabilize the market. And that's right, we did get rid of the individual mandate. The reality is on the individual mandate that 80% of the people that were paying these having to pay the penalty were earning, less than $50,000 a year. So it was almost hurting the very people that it was intended to help. And so, we got rid of that with the idea of trying to create more affordable options for individuals. There's short-term limited duration plans that we've allowed to be out on the market, and those plans don't have all of the Obamacare requirements, so they can be more affordable for families. So, if you look at our record, the facts are premiums have gone down, and there's more choices for individuals in the marketplace.
We're with Seema Verma. She's the administrator of the Centers for Medicare and Medicaid Services. Now, Seema, for many of our listeners that might not be on the exchange, either they have their own plan or they're on a different set of circumstance, maybe a share plan like I am or something like that. If you take your middle plan, which would be your silver plan, average state, average family of 4, just average, right? Everything has a mean. What can a family of four expect to pay if they go on the exchange? Just give me a mean average family of four.
Well, the numbers sort of vary. I mean, they're going to vary by where you live, the location that you're in, whether there's a smoker in your family. So there's a lot of different variables. The other thing to keep in mind is that many people, especially a lot of those that come to the exchange, qualify for tax credit. So even though the premiums may be higher, some people will qualify for some assistance. And so the out-of-pocket, spending in terms of what they're paying in their premiums will really vary by location and all of those different factors. The important thing is to check out healthcare.gov, and that deadline is December 15th because this is the opportunity to find coverage and potentially assistance if you need it.
And Seema, the other thing that I want to make clear is for those people that might qualify for a subsidy towards their premium, that's means-based, right? Totally means-based.
That's exactly it. It is based on your income and your family size.
Right. So obviously as your income goes up, your opportunity, or the higher your income is, you're not going to qualify for a full subsidy, but you might qualify for some. So that's why, look, it makes no sense not to spend the 15 minutes to go to healthcare.gov and just check it out, because information is power. Now, you might check it out and say, this isn't for me. But you might check it out and say, this is better than the plan I've got now. But the thing is, here's the deal, everybody. You got 2 days, right? You got 2 days, and that's it.
That's exactly it. And we've tried to make the process a lot easier. We've streamlined the application to simplify the process, the content. We've tried to improve it, just, all with the focus of making it easier for people to understand and deliver better customer service. Even this year, we have something called a Help on Demand feature, and it can link you to local brokers who can help you work through the process as well. So there's a lot of resources, and our focus is just making it easy for people that are using the healthcare.gov.
Now, Seema, I know you're busy. You got a lot going on, but let me ask you the $64,000 question. May I?
Sure.
So when you talk about reining in spending, right, 1/3 of the budget's gone. I mean, you just can't rein this in. But as you look at this and the growth of it, forget cutting it. Is there a plan going forward to not have this number, this percentage of the federal budget continue to grow? Is there a way that it ever stabilizes? Or in a decade from now, are we looking at $500 billion?
Well, our focus is on making sure that people have access to high-quality care. And I think there's a way to make sure that we continue to have the best healthcare system in the entire world, because we do, and people travel from all over the world to come here to get the great technology, the innovation, and the dedication of the healthcare workforce that we have in America. But we've got to figure out a way to make that care more efficient and more affordable. I think all Americans are feeling this when they're paying premiums and they're seeing their deductibles go up. They're paying higher copays. They're paying more at the pharmacy counter. And so I think that's why the president's been focused on issues that are going to help lower healthcare spending in general. And that's why you've seen that very strong focus on prescription drug spending. We're trying to do a number of different things to increase competition and negotiation while supporting innovation to make sure people are paying less. There's a lot of inefficiencies in the healthcare system. As you know, anybody who's gone to the doctor's office lately, we know that you don't know how much things cost. You don't know about quality, and you certainly don't have your healthcare record. And those are some of the things that the administration is focused on, is empowering patients and making sure that they have the information that they need to make decisions that are going to work best for them. We want to deliver a value-based healthcare system that delivers high-quality care at the lowest cost. And so a lot of our work is focused on that.
I tell you what, Seema, enlightening conversation. Again, for our listeners, bottom line, healthcare.gov. Check it out. Open enrollment is over December 15th, and then you're done until well into 2019. You just can't say, I want to go on in January. It's over. They have a period of enrollment. It closes in 2 days. You have nothing to lose but 10 minutes of time by just going to your browser and going to healthcare.gov and checking it out. and see what's out there. And don't get all caught up in it. You don't like Obamacare or anything else. It is what it is. So what you want to do is get the best coverage for the best price that you can, and we can fight about politics later. Seema, thank you. Great conversation.
My pleasure. Thank you very much.
Appreciate you being with us.